So moving to perhaps non-communicable diseases, just to change the focus a little bit, and you're the first doctor and the first development professional to lead the World Bank group. You talked earlier about the fact that most disease, or most of the burden around Ebola could be addressed by simple health precautions, and of course that's true for most non-communicable diseases at the moment as well, but we have the challenge of providing care to those people who need it. So what do you see as the biggest challenges in building appropriate healthcare systems around the world, particularly in countries in our region here in the Asia Pacific area where the need is so great?
Yeah, I think first of all, the most important thing is we have to really shift the way we think about investments in healthcare. And 20 years ago, when the World Bank and IMF were approaching their 50th anniversary, I was part of a group that was protesting against the World Bank. It was called 50 Years is Enough, and we made the argument that the World Bank should close its doors on its 50th anniversary. And our critique was mostly because we felt that the World Bank and IMF were not really focusing on things like healthcare. I mean, as a medical doctor based, working in global health, investments in health were almost an afterthought. But in a recent study that Larry Summers led, that was in the Lancet, he showed that from 2000 to 2011, fully 24% of the growth, economic growth, in developing countries was the result of better health outcomes. So now I think there's a real understanding that investing in health is part of your economic growth strategy. So now that we know that, then the question is, so then how do you do it? What do you invest in first? What do you invest in next? And in every single country I visited, they have, every single country in the world, as far as I'm concerned, I have not seen one yet that's the exception. Every single country has a problem with their healthcare system in some fundamental way. So the poor countries have trouble just getting basic services. Sierra Leone, Liberia was an example of that. But if you go to the middle income countries, they almost all have the same problem, which is very high tech, very expensive care in the cities, and then difficulty getting services to the outer regions. And then because in the cities they're trying to really copy the healthcare systems of the developed countries, and they're very sophisticated urban dwellers. Can see what healthcare is like in the most advanced centers, and that's what they want. And then, of course, also in developed countries, the costs are skyrocketing. And in the United States, where we spend 17% of the U.S. GDP on healthcare, the estimate is that between 30 and 50% of all healthcare expenditures are not only not helpful, but harmful. So this is a huge and difficult problem. So at the World Bank Group, we're now becoming very serious about helping every developing country, or any country, in fact, that asks us to help improve their healthcare system. And getting the basic services in place is really important, but making really tough decisions about how much you're going to spend on PET scanners and MRI machines for middle-income countries, and how are you going to make sure that rural healthcare is actually in place. My own experience over the last 25 years is that we have not really taken seriously what I've been calling the science of healthcare delivery. The delivery part is the real rocket science. The basic science, of course, has advanced. There's a lot more to do. Clinical science has also advanced. There's still a lot more to do. But we've done almost nothing in figuring out how to build the systems that will actually work. So that's one of the things that we're really going to focus on, and especially in the poorest countries. But I think the Ebola example has taught us that we are not prepared, and especially in the poorest countries, to deal with these pandemics.